So commissioners need to understand several key points about the added value of working with a PROACT-SCIPr accredited organisation like Catalyst Care Group. It is evidence-based practice. So Catalyst Care Group applies the PROACT-SCIPr framework, which is rooted in evidence-based, person-centred approaches. This reassures commissioners that the organisation adheres to the proven methods for managing behaviours of concern. We focus on the reduction in restrictive practices, so this framework emphasises reducing our reliance on physical interventions and restrictive practices. Commissioners can be confident that services promote dignity, respect and the least intrusive interventions possible at all times. Staff competence and confidence. This accredited training ensures that our staff are well prepared, skilled and confident in managing complex behaviours effectively and safely. This leads to better outcomes and fewer incidents requiring emergency responses or external intervention. We also focus on improved outcomes for the individuals we're supporting. So by focusing on positive behaviour support and our proactive strategies, Catalyst Care Group helps individuals to live more independent and fulfilling lives. This aligns with the National Health and Social Care priorities. There's an integrated, consistent approach in everything that we do. So being accredited means that there's that consistent, organisation-wide approach to managing behaviours of concern, ensuring continuity and quality across services for all of our individuals. The accreditation also helps us to meet the standards set by such bodies such as CQC, RRN, NICE guidelines, Ofsted, Mental Capacity Act and human rights, just to name a few. It's also cost effective, so better management of behaviours of concern leads to fewer incidents. This means we have lower staff turnover and reduced reliance on high cost interventions, making services more efficient and more cost effective for commissioners. So working with a PROACT-SCIPr accredited provider like Catalyst Care Groups means safer, more respectful care with measurable outcomes and adherence to best practices, qualities commissioners can rely on.
We're looking at reducing hospital admissions, so prevention focus by identifying triggers and using early intervention strategies. The approach helps prevent escalation to the period of requiring hospitalisation. The escalation skills, staff are trained to manage behaviours safely and calmly, reducing the likelihood of incidents leading to emergency services or inpatient care. Fewer crises equals lower costs. Avoiding frequent or prolonged admissions significantly cuts healthcare expenses and relieves pressure of the NHS services. Decreased use of restrictive practices, so less needed for physical intervention by focusing on proactive and positive behaviour support. The need for restraint or emergency responses decreases, reduces staff injury and burnout. So less confrontation means fewer staff absences or compensation claims, supporting workforce stability and lowering related costs. Improvement community resilience, empower carers and staff, equals consistency, better consistent training enables those in the community settings to manage complex needs confidently, reducing dependencies on specialist or acute services. Stability support systems, so building skills and capacity with the community allows individuals to thrive in their familiar environment. Long-term behaviour change, so personal-centred support plans, those foster trust and predictability, leading to long-term improvement in behaviours of concern. Stability equals lower placement turnover. Individuals are more likely to stay in placements that meet their needs, reducing costs related in transitions and disruptions for the people that we support. Better quality of life equals less intervention. So holistic care planning, when people feel safe, understood and supported, their need for intensive intervention drops. So that freeing up resources to others and increasing overall system efficiency. So by reducing incidents, preventing admissions and empowering communities, PROACT-SCIPr creates a ripple effect of financial savings and resilience building. These outcomes benefit not only individuals and services providers, but also commissioner bodies seeking values-based, sustainable care solutions.
So by being an accredited PROACT-SCIPr centre, it sets Catalyst Care Group apart in terms of safety and clinical governance by demonstrating our deep commitment to person-centred, ethical and evidence-based practices. So here's how the accreditation strengthens both areas. Having robust safety standards, having that proactive risk management in place. So this approach focuses on preventing the behaviour of concern through those early identifications of triggers and the use of proactive support strategies. We have these trained and competent staff, so the accreditation ensures all of our staff across the board receive high quality, consistent training in safe, non-restrictive practices, reducing the risk of harm to both the individuals that we support and the staff that are supporting them. We also have a reduction in incidents, so we have fewer crises because we're so focused on being proactive, improving people's quality of life and making them happy and fulfilled, that there's less need for physical interventions and restrictive practices. So this therefore means that we're going to have less injuries for the people we support and the people we're supporting them. So this naturally enhances our overall safety in all of our services. The strong clinical governance means that all of our policies are aligned with the practice. So as an accredited centre, we operate within our clear structured framework that aligns with all of the national legislation, safeguarding guidance and CQC expectations. The accreditation process also requires evidence of ongoing reviewing, monitoring and improvement of all of our practices, supporting clinical governance through transparency and accountability of all of our actions. And it's evidence-based. It's grounded in positive behaviour support, which is endorsed by the NICE guidelines and supports the best clinical decision making. Our focus is always on human rights and dignity, so the emphasis is always based on the least restrictive approach, ensuring individuals are treated with respect and compassion. All of our behaviour support plans are developed with co-production in mind, getting the people we support involved with their support as much as possible, as well as MDT teams and their support network. This reinforces the ethical care standards that we stand by, and we're always looking on that continuous quality improvement as well. So we always have ongoing training, we've got refreshers, we do bespoke courses, all of our staff undergo regular re-accreditation and reflective learning. So this supports our culture of continuous improvement and clinical excellence. Being accredited means the organisation must demonstrate how we learn from incidents, the feedback that we gain and our audit findings, making sure we're keeping our practice safe and current. It's a mark of trust, safety and clinical leadership. It can assure commissioners, families and regulatory bodies that the organisation prioritises minimising risks, upholding professional standards and continuously improving outcomes for the people we support. It's not just a certification, it's a statement of our quality and commitment to the best practice in all of the support that we deliver.